Men talk about heart health and mental well-being, but colon cancer is often left in the shadows. It's uncomfortable, but silence lets it grow undetected. Colon cancer isn't just for older men, more young men are being diagnosed. By talking openly, learning the risks, and getting screened, we protect our health. Let's start this vital conversation together. Colon cancer starts in the large intestine, often as a small, harmless polyp. Over years, some polyps can turn cancerous, usually without symptoms. That's why screening is so important. It finds and removes polyps before they become cancer. Men are at higher risk, so early detection is key. Prevention starts long before symptoms appear. Take action now. Colon cancer is the third most common cancer in men, and the third leading cause of cancer deaths. The lifetime risk is about 1 in 23. Screening saves lives. Rates are rising in younger men, so guidelines now recommend starting at age 45. Early detection makes a real difference. Take screening seriously. It could save your life. To understand colon cancer, we first need to know where it develops. Your colon, or large intestine, is a 5-foot muscular tube that absorbs water and forms stool. The colon and rectum are connected, and cancers here share many traits. Knowing your colon's role helps you recognize symptoms and highlights why screening is essential for your health. Colon cancer almost always starts as a small, harmless growth called a polyp. Most polyps are benign, but some, like adenomas, can become cancerous over years. This slow change gives us time to find and remove polyps before cancer develops. Colonoscopy lets doctors spot and remove polyps, stopping cancer before it starts. You'll often hear the terms colon cancer, rectal cancer, and colorectal cancer used, and it can be really helpful to understand the difference. As we've talked about, colon cancer starts in the main part of the large intestine, the colon. Rectal cancer, on the other hand, starts in the last several inches of the large intestine, which is the rectum. While they're in slightly different spots, these two cancers have a lot in common. They develop from the same types of cells, come from similar polyps, and often show up with overlapping symptoms and risk factors. That's why doctors and medical organizations usually group them together under the umbrella term colorectal cancer. This combined term is useful when we're talking about general statistics, risk factors, and screening guidelines, since the approach to prevention and early detection is the same for both cancers. Finding and removing polyps anywhere in the large intestine helps prevent both diseases. But when it comes to treatment, the specific location, colon versus rectum, becomes really important. The rectum sits in a tight space in the pelvis, surrounded by other organs and structures like the bladder and, in men, the prostate. This anatomical detail can make surgery on the rectum more complex than surgery on the colon, and sometimes it requires a different approach or even extra therapies. For instance, treatment for rectal cancer might involve radiation therapy and chemotherapy before surgery to shrink the tumor and make it easier to remove completely. That's a common strategy to lower the risk of the cancer coming back in that area. For colon cancer, surgery is usually the first and main treatment, and sometimes chemotherapy is recommended afterward, depending on how advanced the cancer is. The specific therapies chosen by your medical team will really depend on whether the cancer is in the colon or rectum, how far it's progressed, and your overall health. So while colorectal is a handy shorthand, the distinction actually matters a lot when it comes time for treatment. For you, as a man wanting to understand your health, the key takeaway is that any abnormality in your large intestine is a reason to pay attention. Whether it's called colon cancer or rectal cancer, it starts in the same system and is found using the same screening methods. The first steps you need to take, understanding your risk, looking out for symptoms, and getting screened at the right age, apply to the whole colorectal region. The medical terminology becomes more important after a diagnosis, since it'll help guide your doctors in creating the best and most personalized treatment plan for your situation. The facts are pretty clear. Men are disproportionately affected by colorectal cancer. Men have a slightly higher risk of developing this disease and, more importantly, a higher mortality rate compared to women. This difference isn't just about biology, it's also shaped by behavior and societal norms. Historically, men have been more likely to avoid going to the doctor for routine checkups or to talk about symptoms that might feel embarrassing, especially anything related to bowel function. This kind of delay can have serious consequences because it gives the cancer more time to grow and reach a stage where it's much harder to treat successfully. There are several reasons for this increased risk. Lifestyle choices that are more common among men, like eating more red and processed meat, drinking more alcohol, and higher rates of smoking, are all known risk factors for colorectal cancer. Also, men tend to store more fat around their organs, called visceral fat, which is metabolically active and linked to a higher risk of several cancers, including colon cancer. All of these biological and lifestyle factors combine to create what you might call a perfect storm, making it really important for men to be especially vigilant about their colorectal health. It's a unique vulnerability that calls for a proactive and informed response. On top of that, there's the rising trend of colorectal cancer in younger adults, often called early-onset colorectal cancer, which is affecting men more than women. Researchers are still trying to figure out exactly why this is happening, looking at things like changes in diet, the gut microbiome, and environmental exposures over the past few decades. But whatever the reason, the point is that thinking of this as just an old man's disease isn't safe anymore. Men in their 30s and 40s now need to consider themselves at risk and be aware of the symptoms, even if they're not yet old enough for routine screening. This is why this conversation is so important. It's about breaking down the barriers of silence and stigma that keep men from taking action. Your health isn't something to tough out or ignore, hoping the problem will just go away. When it comes to colon cancer, what you don't know can hurt you, but what you do can save your life. Paying closer attention means understanding your personal risk, having honest conversations with your doctor, and following through with recommended screenings. It's a simple but powerful change in mindset, from just hoping for the best to actually taking steps to prevent disease that every man needs to make for his own well-being. Colon cancer is the third most diagnosed cancer among men in the US, with over 150,000 new cases expected in 2024. Early detection is key. When found early, the 5-year survival rate is over 90%. Screening now starts at age 45 as rates in younger men are rising. African American men face the highest risk, highlighting the need for awareness and action for all men. Colon cancer is often silent early on, but as it grows, symptoms appear. Watch for changes in bowel habits, blood in your stool, persistent abdominal discomfort, unexplained weight loss, or fatigue. These signs are your body's warning. Don't ignore them. If you notice any of these, talk to your doctor right away. Some colon cancer risk factors like age, personal or family history, and certain genetic syndromes can't be changed. Knowing these risks helps you and your doctor decide when to start screening and how often. If you have a family history or inherited gene mutations, early and frequent screening and even genetic counseling may be vital. Share your history with your doctor, it could save your life. You can't change your genes or age, but your lifestyle choices have a huge impact on colon cancer risk. Diet matters. Eating lots of red and processed meats raises your risk, while fruits, veggies, and whole grains help protect you. Staying active and maintaining a healthy weight are key. Exercise lowers inflammation and helps your digestive system. Smoking and heavy drinking both increase your risk. Cutting back makes a real difference. Start small. Swap out red meat, take a daily walk, and limit alcohol. Every step counts. These changes don't just lower cancer risk, they boost your overall health and well-being. Early detection saves lives. Colon cancer grows slowly, giving us a window to act. Screening finds and removes polyps before they turn cancerous. It's true prevention. Don't wait for symptoms. By then, it's often too late. For men, this means being proactive. Schedule screenings even if you feel fine. Talk to your doctor about your risk and when to start screening, usually at age 45. Prioritizing early detection gives you the best shot at a long, healthy life. Colonoscopy is the gold standard for colon cancer screening. It finds and removes polyps in one step. Prep is key. Follow the instructions so your colon is clean for the best results. The procedure is painless thanks to sedation, and you'll be back to normal activities quickly. If polyps are found, they're removed on the spot, preventing cancer before it starts. Most men only need a colonoscopy every 10 years if results are clear. One test can give you a decade of peace of mind. Colonoscopy isn't the only option. There are simple, non-invasive stool tests like FIT and stool DNA tests. These tests look for hidden blood or abnormal DNA in your stool and can be done at home. Positive results mean you'll need a follow-up colonoscopy. Stool tests are less invasive but need to be done more often, every 3 years. Only colonoscopy can remove polyps during the test, but your doctor can help you choose the best option. The key is to get screened, whichever method you choose. Most men should start colon cancer screening at age 45, earlier if you're high risk. High risk means a family history, genetic syndromes, or personal history of IBD. Screening may start as early as your 20s. Know your family history and share it with your doctor. It shapes your screening plan. Don't wait for your doctor to ask. Be proactive about your health. Choose the right test and timing with your healthcare provider. Following these guidelines is your best defense against late-stage colon cancer. Screening tests can spot signs of colon cancer, but only a biopsy confirms the diagnosis. Biopsies are usually taken during a colonoscopy if something suspicious is found. A pathologist examines the tissue, confirming if cancer is present and its type. Staging then shows how far the cancer has spread, guiding your treatment plan. You can lower your risk of colon cancer by making smart choices at the table. A diet high in fiber, fruits, vegetables, beans, and whole grains protects your colon, while red and processed meats increase risk. Small changes like swapping white bread for whole grain and adding more plant-based meals make a big difference. These habits build a strong defense for your health. Beyond nutrition, your daily habits and physical activity level play a profound role in colon cancer prevention. Regular exercise is one of the most effective tools you have to lower your risk. Engaging in consistent physical activity helps you maintain a healthy body weight, which is critical because obesity is a major risk factor for colon cancer, particularly in men. Exercise helps reduce levels of insulin and other growth factors in the blood that can encourage the development of cancer cells. It also boosts your immune system and reduces chronic inflammation throughout the body, creating an environment that is less hospitable to cancer growth. The recommendations are straightforward and achievable. The American Cancer Society suggests that adults get at least 150 to 300 minutes of moderate intensity physical activity per week. This could be something as simple as a brisk 30-minute walk 5 days a week. If you prefer more vigorous activities like running, swimming, or cycling, the goal is 75 to 150 minutes per week. The key is consistency. Find activities you genuinely enjoy, as this will make it easier to stick with them for the long term. Even small amounts of activity are better than none, so break up long periods of sitting by taking short walks or doing stretching exercises throughout your day. 2 other lifestyle choices have a significant and direct impact on your risk: smoking and alcohol consumption. If you smoke, quitting is one of the single best things you can do for your overall health, including reducing your colon cancer risk. Smoking introduces a flood of carcinogens into your body that can damage cellular DNA and promote cancer. Similarly, heavy alcohol use is a known risk factor. Alcohol can act as an irritant to the lining of the colon and interfere with the absorption of protective nutrients. Limiting your intake to no more than 2 drinks per day for men is the guideline for moderation, and less is always better. Ultimately, prevention is about creating a lifestyle that supports your body's natural defenses. It is a holistic approach that combines a healthy diet, regular movement, maintaining a healthy weight, and avoiding harmful substances like tobacco. None of these actions exist in a vacuum. They work together synergistically to lower your overall risk profile. While no single behavior can guarantee you will never get cancer, adopting these protective habits significantly shifts the odds in your favor. It is an investment in your future well-being, empowering you to take meaningful control over your health and reduce your risk of this preventable disease. A colon cancer diagnosis is life-changing, but there are many effective treatments available. Your care team will personalize your plan considering the cancer's stage, your health, and your preferences. Treatment often includes surgery, chemotherapy, and radiation, sometimes in combination. Newer options like targeted therapy and immunotherapy are also available for advanced cases. Your team will guide you, supporting you through every step toward recovery and survivorship. For the majority of men diagnosed with colon cancer that has not spread to distant parts of the body, surgery is the cornerstone of treatment. The fundamental goal of the operation, known as a colectomy, is to remove the segment of the colon containing the tumor, along with a margin of healthy tissue on either side. The surgeon also removes the nearby lymph nodes, which are small bean-shaped glands that are part of the immune system. These lymph nodes are then carefully examined by a pathologist to see if the cancer has begun to spread, a critical step in determining the cancer's stage and guiding decisions about further treatment, like chemotherapy. The extent of the surgery depends on the size and location of the tumor. If the cancer is in a very early stage and confined to a polyp, it might be removed completely during a colonoscopy in a procedure called a polypectomy. For larger tumors, a partial colectomy is performed. After the cancerous section of the colon is removed, the surgeon will, in most cases, be able to reconnect the two healthy ends of the colon. This procedure is called an anastomosis, and it allows for normal bowel function to be restored after you have recovered from the surgery. This is really the most common and desirable outcome for patients undergoing a colectomy. In some situations, particularly in emergency surgeries for a blockage, or if the reconnection is not safe to perform immediately, the surgeon may need to create a stoma. A stoma is a surgically created opening on the abdomen that allows waste to leave the body and be collected in a bag. When the upper part of the colon is brought to the abdominal wall, it's called a colostomy. When the small intestine is used, it's an ileostomy. For many colon cancer patients, a stoma is only temporary, designed to give the reconnected bowel time to heal. A second smaller surgery is performed a few months later to reverse the stoma and restore the normal path of digestion. Modern surgical techniques have advanced significantly, making the procedure safer and recovery faster. Many colectomies can now be performed using minimally invasive methods, such as laparoscopic or robotic-assisted surgery. These techniques involve several small incisions instead of one large one, resulting in less pain, a shorter hospital stay, and a quicker return to normal activities. Your surgeon will determine the best approach for you based on your specific case. Regardless of the technique, surgery remains the single most effective weapon for curing localized colon cancer, offering the best chance for a complete and lasting recovery. Surgery is the main treatment for localized colon cancer, but chemotherapy, radiation, and targeted therapies are crucial reinforcements. Chemotherapy helps eliminate hidden cancer cells and reduce recurrence risk, especially after surgery. Radiation is used more for rectal cancer, often combined with chemo to shrink tumors before surgery. Targeted and immunotherapies offer new hope for advanced cases, guided by genetic testing. The journey through colon cancer treatment is not just a physical battle, it is also a profound emotional and psychological challenge. The treatments that are so effective at fighting cancer can also cause a range of side effects that impact your daily life. Chemotherapy, for instance, can lead to fatigue, nausea, hair loss, and an increased risk of infection. Surgery has its own recovery period involving pain management and temporary changes in bowel function. Radiation can cause skin irritation and fatigue. Learning to manage these side effects is a crucial part of the treatment process. Your medical team will provide medications and strategies to help minimize discomfort and keep you as strong as possible. Open communication with your doctors and nurses is essential. Do not downplay your symptoms or tough it out in silence. There are effective treatments for nausea, pain, and diarrhea. Being honest about how you are feeling allows your team to adjust your care plan, perhaps by changing a medication or recommending supportive therapies like acupuncture or massage. Fatigue is one of the most common and persistent side effects of all cancer treatments. It is important to listen to your body, allow yourself to rest when needed, and focus on gentle activity, like short walks when you have the energy. Good nutrition and staying hydrated are also vital for maintaining your strength during treatment. Beyond the physical toll, a cancer diagnosis can bring a wave of powerful emotions, including fear, anxiety, anger, and depression. It is completely normal to feel this way. Acknowledging these feelings is the first step toward managing them. Many men find it difficult to talk about their emotions, but seeking support is a sign of strength, not weakness. Your hospital or cancer center will have resources available such as social workers, counselors, or psychologists who specialize in helping cancer patients. Talking to a professional can provide you with coping strategies and a safe space to process your experience without judgment. Connecting with others who have been through a similar journey can also be incredibly healing. Support groups, either in person or online, allow you to share experiences and advice with fellow patients and survivors. These groups can reduce feelings of isolation and provide a sense of community with people who truly understand what you are going through. Your family and friends are your primary support system, but sometimes the burden of a diagnosis can strain even the strongest relationships. Leaning on a combination of professional help, peer support, and your personal network creates a robust safety net to help you navigate the emotional ups and downs of the cancer journey. Completing active treatment for colon cancer is a major milestone, a moment of relief and celebration. However, life after cancer is not simply a return to how things were before. It is an entry into a new phase known as survivorship. This period involves adjusting to a new normal, which includes ongoing monitoring, managing any long-term side effects, and embracing a renewed focus on health and wellness. Your relationship with your oncology team will continue, but the focus will shift from active treatment to surveillance. This is a critical part of your long-term care, designed to watch for any signs of cancer recurrence and manage your health moving forward. Your follow-up care plan will be personalized but will typically include regular checkups with your oncologist. These visits may involve physical exams and blood tests, such as checking for a tumor marker called CEA. You will also need periodic imaging tests like CT scans to monitor for any signs of recurrence. A crucial component of long-term surveillance is a follow-up colonoscopy, usually performed about 1 year after your initial surgery. This is done to check for new polyps and to ensure the surgical site has healed properly. Subsequent colonoscopies will be scheduled at regular intervals based on those findings, ensuring your colon remains healthy for years to come. Physically, you may have to adapt to some lasting changes. For many men who have had a portion of their colon removed, bowel habits can be different. You might experience more frequent bowel movements, looser stools, or increased gas. These symptoms often improve significantly over the first year after surgery, but some changes may be permanent. Working with your doctor or a nutritionist can help you identify dietary adjustments that can manage these symptoms. For men who have a permanent stoma, learning to live with an ostomy bag is a significant adjustment, but with education and support from specialized nurses, it becomes a manageable part of a full and active life. Mentally and emotionally, survivorship can be complex. While there is joy and gratitude, there can also be a lingering fear of recurrence, often called scanxiety, around the time of follow-up tests. It's important to acknowledge these feelings and continue to use the support systems you developed during treatment. Survivorship is also an opportunity to take control of your health in a new way. Many survivors are highly motivated to adopt healthier lifestyles, focusing on a balanced diet, regular exercise, and stress management. This new normal, while different, can be a rich and meaningful chapter, defined not by the cancer you had, but by the life you choose to live moving forward. Colon cancer is a serious threat, but knowledge is power. We learned it often starts as a polyp, making early screening vital, especially as cases rise in younger men. Recognizing symptoms and risk factors, talking with your doctor, and making healthy choices can save lives. Stay proactive, and remember, you have the tools to protect your health. Silence around men's colon health is a real risk. For generations, men have avoided these conversations, but breaking that silence is an act of self-care. Start with honest talks, with family, friends, and your doctor. The conversation you begin today could save your life tomorrow. Knowledge and open dialogue matter, but action is what truly changes lives. Make a commitment to your health, schedule a checkup, talk to your doctor about colon cancer risk, and take one small step toward a healthier lifestyle this week. Share what you've learned with the men in your life. Your health is in your hands. It's your move.